Okay guys, so we've gotten through part 1 and part 2 and we're getting to the exciting part of the claim. This is really important for the physician's interest. This is how he or she will get paid for the services they render. So we need to ensure that we are clear, very, very clear about the diagnosis codes that we're using and the procedural codes that we're using. They have to relate to each other. So let's go ahead and start looking at fields 14 to 33. Now, don't get scared. We don't have to complete every field. Remember, on a claim, we only complete what applies. So let's start with field number 14, date of current condition, illness, injury, or pregnancy. Why is this date important? This date is important to the insurance because they look at pre-existing condition. That is a clause in the insurance contract between the patient and the insurance. But for the purpose of completing the claim, we just need to be sure that we put the appropriate date as given to us by the patient. Number 15, if patient has had the same or similar illness, give the first date. This is where we actually indicate, based on what the patient tells us, when was the first time they had this illness. Again, this is all dates. Field number 16, dates patient unable to work in current occupation. If the patient stopped working, you need to make sure you complete that field. Otherwise, you don't touch it. Number 17, name of referring provider or other source. If the patient was referred to your office, you want to make sure that you put that information. But in addition to that, you have to complete 17B. That is the National Provider Identification Number, and that applies to the referring provider. That just tells the insurance companies that this provider referred the patient to this physician. Now, field number 18, hospitalization dates. Was this patient hospitalized? If the patient was hospitalized related to the condition they came in to see the physician for, then you need to indicate it. Otherwise, you don't have to put that information there. Number 19, reserved for local use. This information you only complete it if the payer is asking you to complete it. So then again, you need to make sure what is the preference for claim submission of the payer. Number 20, outside lab. Sometimes we'll have patients who come in and we need to have some lab work drawn for them. Now this refers to, did we take the specimen in the office and submitted it to the lab, or did we send the patient to the lab? Yes or no, it's that simple. If we submit it to the lab and the lab charged us, we need to transfer those charges onto the claim. But also, when we do our own labs in the office, you're going to build that as a procedure, and that's a different part of the claim, which we'll get to it in a minute. Field 21, it's about the diagnosis codes or the nature of the illness. So this is where we tell the insurance what the patient came in for. What illness do they have? What is the final diagnosis? This is important. It's the reason why we're billing. So we need to make sure we tell them so they understand. Field number 22, Medicaid resubmission code and original reference number. This is only referring if we have a Medicaid-related resubmission claim. If we have a PPO that's an initial claim, we do not need to worry about this field. Number 23, prior authorization number. This is an important field because in most cases, if there are special devices that we need or special procedures that are going to be performed, we need to make sure that we know whether the patient needs an authorization. If we recover an authorization, we need to indicate that. That will lead to payment. If we do not indicate that, the probability of not getting paid is very high. So number 23 is very important as well. Now we're getting onto the big portion of the claim, and that is indicating what it is that we did at the doctor's office. The justification for the charges, basically.